I'm Dr. Chris. I'm the founder of MuscleCare, and I'm a chiropractic doctor. I have been for 32 years. I've seen over 20,000 patients. And what we've learned is that when patients understand where their pain comes from, they get better way faster. So this is back education. When you have symptoms, I'm going to try to give you an idea of where they could be coming from to help direct you and your doctors or therapists to finding the cause of your pain. I want to break chronic pain. There's 160 million Americans out there. 1 in 3 have chronic pain lasting over 6 months, and I want to stop it today. So when you've got headaches, most headaches come from the suboccipital region, a nerve compression on cervical 1 or cervical 2. Other headaches come from a contraction in the trapezius or levator muscle and radiate up to the side of the head. The other part is the scalene muscle can also be compressing on the carotid blood flow or the nerves in the front of the neck radiating up into the face. So headaches coming from the neck is very common and must be looked at in those 3 places. Secondly, if you've got vertigo or dizziness, a lot of the time we'll again find compression at the top of the neck, front of the neck. We'll find at the top of the thoracic chain, which is thoracic 1, because when that area is irritated from looking down so much, or if you're a mechanic looking up under cars, that area becomes agitated and the muscles and blood vessels compress the blood flow and oxygen from the neck into the brain. So again, check the neck if you feel vertigo or dizziness. It's not always the ear or the inner ear. As far as tonsillitis, sore throat, this sort of thing. If you can't solve the problem and you don't have any infection but you always have a sore throat or difficulty swallowing, what I'd highly recommend is checking the anterior scalene muscles and sternocleidomastoid muscles and how they compress and agitate the front neck joints and nerves. Again, that's a chiropractic and massage therapy thing, so go to them first if you're having problems with the medical side and there's no diagnosis. Next thing, a lot of people get numbness or tingling down their arms. If it's in both arms or one arm, it's not necessarily a heart attack. What it is very often anterior neck nerve compression, blood vessel or nerve compression in the armpit, or upper back nerve irritation, maybe even having a rib that's dysfunctional out of alignment. So look to those for numbness and tingling or cramping in the hands. Finally, there's chest pain. Chest pain can be referred from C5 and 6 in the neck. It can be a contraction of the muscle locally, or it can even be a rib out of alignment in your back radiating through the chest wall. If you've got upper back pain, in the old days they used to call this secretary's syndrome, but it's called cervicogenic dorsalgia, and that means neck origin upper back pain. The neck nerves here and here descend 6 inches into the back. So if you have a spots pain, we call that cervicogenic dorsalgia, and that's coming from your neck. You'll also find that if a rib or a back joint is out of alignment, that would also cause upper back pain. Of course, you can have internal problems with your heart and your lungs, etc., that radiate to the back. But again, most commonly, many people even go to a hospital with what's called pseudo-angina diagnosis, and that's where they thought they were having a heart attack. But really they didn't, they just had a rib out of alignment or a spasm in their upper back. If you've got back pain can come from, again, the back joints, the back muscles. But what about the small bowel and the large bowel? Because if you've got a small bowel problem like irritable bowel syndrome, you're always going to have pain here and across the flank. If you've got constipation, lumbar 4 and 5 will be painful in your back. And again, one can cause the other. So you could have a back problem and then end up with constipation. If you get your back fixed through adjustments and exercises, etc., you might find that that helps tremendously. If you've got pain in your buttock, and pain down your leg, pain in your calf, many of the time those particular problems, if they're not throbbing and sharp and intense at rest, they could be coming from the back nerves, the sacral nerves, all the way down. There could be a spasm in this muscle. This is called popliteus. Popliteus is often in spasm, especially on the right side from driving. So if your right calf is tending to the left, do a calf stretch and release popliteus. If you've got pain in your ankles, pain in your feet, swelling in your feet, again, that could be a circulatory issue. It could be a lower back issue. It could be a muscle problem in the knees not allowing blood flow to come out. But also don't forget to look at the arches of the feet, because most people tend to roll in. 75% of people pronate. And that in itself puts a tremendous amount of stress on the calf and the ankle. So if you can change that, work that stress out of the plantar fascia, you've heard that before, plantar fasciitis when it's inflamed, that in itself, if you release that, will help blood flow and nerve irritation passing through those calves all the way up your leg to your back to your brain to unwind. So that's kind of my head to toe, where do things come from, summation of back school. I'm Dr. Chris, have a great day.